2 of the Food for Therapy podcast. I'm your host, Therese Bolden. Welcome to the show that combines my training and specialties of psychotherapy and counselling, personal development and writing with my passions of food and hosting and culture. And on today's episode, I've got the lovely Dr. Belinda Mackie, psychoanalyst, and the topic, you're not going to want to miss this for all of you out there who are wondering how to find the right therapist. This is what you need to know. But first, if you want to find the recipes for our wonderful mezze plate, you can go to the website or you can go to our links. Stay tuned for this episode. Hi, Belinda. Thank you for coming to my home and my table. And what a topic we have. You and I have talked often about the importance of letting people know the fundamentals that they ought to research when looking for the right therapist.
Absolutely.
What do you think we should know? Any lay person in Australia, because there's not a lot of information around about therapy.
Very little.
What should they need? What should we need to know?
First is to know that you are consulting someone else and to not give over your power to them.
I love that. I've often said this to friends of mine.
It's true.
I know.
Because if you say, if you go to your GP and you say, I need to talk to somebody because I'm, I don't know, depressed, and they just send you to someone and you feel that you're in their hands, it's not a good outcome. It can't be a good outcome unless you're in charge. So you need to consult with someone, not they are going to do something to you. It's also to not be afraid to ask them who they are, where they come from, what their qualifications are,
right.
If they've had their own therapy, their ideas about therapy, any of these kinds of things. It's important, and to know what you're looking for, and specifically, do you want to talk to somebody just to get some tips on, you know, how to show up at the next job interview? Or do you want to deal with some deeper, long-standing issues like why is it that you and your mother don't get on?
Right.
Or why are you unhappy? Or why do all your relationships fail? They're deeper-seated issues that need longer time. So people have to be realistic about what they're looking for.
But how do you, I mean, most lay people out there have no concept of what it means to be in therapy. And look, I always use myself as an example. I didn't know when I started my therapy with my analyst what I was getting into. I had no idea. All I knew was that I was symptomatic, I was deeply depressed, I was grieving my mother's death, and my survival mechanisms weren't working.
Yeah.
So how does someone in that situation who feels depleted, who feels overwhelmed, who feels like they can't function, take control of their own life? How do they get to that? I mean, isn't that a process?
It's definitely a process because you can't just know that.
Of course.
I guess number one is to know who you trust. So it's asking friends, family, your GP, any of these people, if they know somebody, if they've experienced somebody, to know who to ask for a referral,
right.
a reference for somebody,
right?
And ask around. Definitely ask around. But I mean, it is hard to know what you want at that time. So it's like, in a way, you put anybody you see on probation,
right?
And yourself on probation.
Yeah.
Is this working out for me or not? When you see somebody. And the other thing is seriously, it is such a complicated world out there to know the difference between what's psychoanalysis, what's psychology, what's psychiatry, what's counselling.
I know.
And what are the qualifications behind it?
I know.
So it's another one to launch into.
Look, it's a big world. And I always say that when you're embarking on a therapeutic journey, ask yourself, what is it that you want help with?
Yes.
Right? So if you're in a state of total disarray and you're having suicidal ideations and you're depressed, you're definitely going to need someone who is, one, definitely qualified, certified and bona fide. So I would imagine it would be a combination of a psychiatrist as well as a psychoanalyst who deals with the unconscious, which is what I
If you need medication,
yes,
psychiatrists mainly prescribe and diagnose,
correct,
and assist you into hospital. Psychiatrists aren't really trained in
psychoanalysis.
therapy.
No, I totally agree.
Yeah, they have one case in their training.
Yeah.
And it's not really a priority. I mean, some go on to do further training, but you won't get therapy from a psychiatrist. You'll get medication.
You'll get a diagnosis.
You get a prescription.
Yeah, and a diagnosis. And this is why I say that it's generally going, and I'm using the most extreme of circumstances because there are a lot of people out there that are in these situations.
Absolutely.
And it's, unfortunately, we're in a country that is incredibly conservative when it comes to mental health and the services that are provided. And 12 sessions of psychology is not going to cut it for someone who's deeply grieving and depressed. Yeah. And so I always say the decision to be medicated is your decision in conjunction with your therapist, a conversation you have with your therapist as to whether or not medication is the right thing for you. But ultimately, the medication will just help to alleviate the symptoms. You'll still need to do the work on yourself. You still have to do the work on yourself. And, you know, having had 20 years of psychoanalysis, I know that that is the one therapy, because it delves into the unconscious and the childhood, that does work, but it is a protracted process, and a lot of people don't want to commit that time to it. But you may be in a situation like I was, which is you just want to survive, and you might end up with a psychoanalyst who then helps you through that process. And honestly, it's the most profound experience to know yourself, because in knowing yourself, you can know others, I believe.
That's true.
And I believe, you know, in knowing myself, especially after I decided to go on to get trained in therapy, you know when you're transferring as well, and you're not projecting onto other people. You know what's yours, you know what's theirs. Yep. Whereas I find that a lot of people don't understand that.
They do not.
Yeah. So the vulnerability point where you said that it's important not to go into a session with a therapist and put them up on a pedestal can be hard for people when they're in that situation, you know. But let's talk a little bit about the different modalities of therapy. Let's start with analysis, because that's your forte.
Well, so psychoanalysis, well, of course, the first psychoanalyst was Sigmund Freud, going back. And there's various other analytic traditions over the last century and a half that are out there, predominantly a different kind in America, in England, and here even. But the basic principles are that anybody who's in training as a psychoanalyst has their own analysis.
Yes.
Definitely. And that's an analysis that's, some people have 2 or 3 analyses. Also, they have their, they do like a degree in psychoanalytic studies. They usually belong to an organization where they present their clinical work to their peers, write and present papers, are involved in an organization. I'm speaking about the Australian Centre for Psychoanalysis. That's in Melbourne, but that people also have their own clinical work, that they actually see patients and have supervision for that. It's mandatory to be registered at the Australian Centre for Psychoanalysis, because I'm on the committee, I know. You have to have a minimum of the same patient in treatment for 2 years. That's a minimum that's acceptable.
Right.
To actually show that you can actually hold a patient in treatment, but that a person can work with you for that sustained period of time.
Right.
So it's not about coming and having a quick fix.
No.
It's about more sustained work.
And it's not for the faint-hearted. And I always say that to people. You know, if I had, it's like the chicken and the egg. If I had the knowledge that I have now back then, would I have entered psychoanalysis? I probably would have, because I was desperate. I was desperate to get help. And it's such a profound journey. But I want our audience to understand more why this is a really important therapy and why Australia specifically struggles with this modality.
Look, it's a view. It's a traditional view that psychoanalysis is for the well-to-do, people who have money, because it's a longer-term treatment, and people who it's not really covered by Medicare at all. It's the quick sessions, 12. The idea is we're in modern society where it's a quick fix. You have quick therapy and you get a quick result.
Right.
And it never happens. People who don't actually follow a way of understanding themselves and tolerating themselves and making choices and decisions around their symptoms will turn to something else, like drugs, alcohol, becoming more symptomatic, burdening the family.
And they don't realise they're doing
physical ailments.
Yeah.
So that they become more and more unconscious. So the difference is to do with what's conscious and unconscious. What is unconscious is out of your awareness. And what the therapy does is it teaches you to understand the nature of your own unconscious,
of course,
by virtue of its side effects, so to speak.
Yeah. So the way I describe it to people is that the blind spots that most people have, you don't have anymore, right? And there's, it's a blessing, but it also means that you can't shut it off. You can't. You're so conscious. You're a conscious individual. You become this. What's the right word for it? Ethics, but you're very ethical in the way that you see the world and you view the world, but you're also very
humility,
yes,
because you become aware of your own inadequacies.
Yes.
And when you are symptomatic yourself, you sit with it. One of the things I've noticed is that people, and I can say this a lot, people who can sit with themselves for at least 15 minutes have a better chance of being aware of themselves.
Yes.
Because I don't know whether I notice it a lot. Very few people can just sit still without being on a gadget, being on a phone, yakking, filling the space up with something else. So to be able to work in analysis, maybe that's the only time you get to be still is when you're on that couch. So to differentiate, psychoanalysis can be on the couch, but it can be applied in multiple different settings. So my PhD is on the treatment of psychotic illnesses, and that's certainly often not on the couch because people like that will be sometimes needing hospital admissions, support workers, family involvement, those kinds of things. So it's a psychoanalyst working in those fields, not just for the wealthy
private practice
on the couch.
So
that's my big thing. Some analysts will never work in the mental health field. That's fine. But psychoanalysis, you'll find that there are quite a few people in the mental health field, psychology, any allied health professional or medical professional could have psychoanalytic training.
Right.
And you may not even know it unless you ask questions of the person.
Which is so important to us, those questions. I want to say this wonderful quote by Carl Jung, psychoanalyst, says, until you make the unconscious conscious, it will direct your life and you will call it fate. And that's really what I explain to people is that, if you want the long-lasting results, you've got to do the work.
You do.
You have to do the work. You have to learn to sit with the intolerable. You have to learn to sit with feeling anxiety. You have to learn. And look, everybody has to live with a certain level of anxiety, but I'm talking about a heightened level of anxiety. You have to learn to sit with dark thoughts. You have to learn to sit with your shadow and work through that to understand it. And it's not for everyone, but I think it's important that we highlight the different modalities of therapy available and the things that you ought to ask questions about because you are the one in the driver's seat. That's right. So it's important that rather than putting your therapist up on a pedestal, take the bull by the horns, ask the questions. What are your qualifications? Do you have your own therapist? All these questions are so important. What is the modality that you treat with?
That's correct.
So what else about the different therapies. Psychology is the one that's used mostly in Australia, which, look, I mean, I think CBT is fantastic as a modality to deal with certain things like, cigarette addiction or what, just a habit that you want to break. But if you're dealing with long-term residual trauma, like the impact of trauma, I feel like psychoanalysis would be the way to go. But let's talk about psychology. Why do you think it is that we're so reluctant in this country to take on psychoanalysis? I mean, aside from the fact that
although all the majority of psychoanalysts I know are psychologists, look, it's got to do with they come out with a master's in psychology, and they've done 3, 4, 5, 6 years. So it's a long time, but they come out with a master's or even a PhD, and they've got CBT because is their prime therapy.
Right.
That's cognitive behavioural therapy.
Yeah.
And what that does is that then fits in nicely with the government's 12 sessions.
I know.
So it's a bit like pick a symptom, road rage, let's say, pop it into these 12 sessions, and let's see how you come out. So it's designed to treat a specific area or symptom, and the person then goes away with their own personality, their own self intact, but a little bit of road rage has been managed. And maybe they can sustain that with road rage. That's just an example, by the way.
Yeah. No, it's a good example.
Because it's out there, right? And they've maybe managed it a little bit better. They've got some tools. Breathing. Think about something else when you're
mindfulness.
Anything like this. Change. So cognitive behavioural therapy is to be aware of the thinking and the feelings behind the action.
Right.
So that if you're aware of it, you can then have some tools and tips to actually shift that. Now that maybe for some people that's what they want, and that's all they'll do.
And that is fine.
That's fine.
We're not here to diss or to say, one is better than the other. It's more about the appropriateness of different modalities for different ailments. So I would say that if you've had childhood trauma, significant childhood trauma, domestic violence, domestic abuse, sexual abuse, then you're probably more inclined to go down the road of psychoanalysis, because that is really unearthing the unconscious, bringing the trauma to the forefront so that you can face it and deal with it and move through it. Psychology, as Belinda just said, is obviously it's science-based, and that's one of the reasons probably why it's used in abundance in Australia.
Evidence-based.
But that doesn't mean that psychoanalysis doesn't have proof that it actually works. I'm living proof that it works. I'm living proof that you can. I feel like I rebuilt myself. I unearthed all the trauma. It all came to the surface in the forefront, and then I reconstructed.
You see, but you've got a good attitude. You've got an attitude of using the therapy productively. Some people have resistance to themselves, really, and that can make it harder for them. The other thing is one thing is the treatment modality. The other is the individual analyst or psychologist or whatever themselves. Because seriously, some psychologists who use CBT are amazing.
Right.
They're intuitively really good.
Right.
But they don't necessarily have their own therapy, and sometimes they get themselves into deep water in therapeutic relationships with people. I don't mean transgressions, although that's there a lot. It's to do with actually getting in too deep and not knowing how to manage the transference. Now, the transference is really important.
Let's speak about that, because that's part and parcel of the vulnerability as
completely.
Well. Yeah.
So the transference is the relationship between the therapist and I'll say patient, client, use whatever word.
Yeah.
And it's the nature of that relationship. So generally, if there's a positive transference, what you're doing is you're transferring those positive attributes to your therapist based on that positive regard for your mother. let's say, if it was like that.
Yeah.
But it's also, it's what you were saying is that you're desperate, you're looking for help somewhere, and somebody's kind, and they look like they know what they're doing, you will put all your faith in them. Now, that's the lubrication for the therapy, which is good. However, it can also have a downside because people maybe don't know how to manage the transference very well.
Right.
Professionals.
Right.
So that makes it really tricky because you can even get some analysts who are inexperienced. So it's incumbent on you to check it out and be guided by your own intuition, your own experience, your own feelings about what's happening in the room. And it is no shame to say goodbye and find somebody else.
Oh, absolutely. I remember early on in my own analysis, my analyst referred me on to a colleague of hers, and I felt incredibly judged in my session with her and said, "Thank you very much, I won't be coming back." So yes, you need to, it's the three essential things that I think have to exist with any therapeutic relationship is the unconditional positive regard, the non-judgment, the containment, and the trust.
Definitely.
These are the essential elements which, ironically are part and parcel of any relationship that you have. That sense of feeling non-judged, it gives you this sense of affinity with someone, that sense of feeling contained and safe, gives you that sense of wanting to be around that person. And it exists in a professional context, obviously, but it's so essential to, I think, any therapeutic relationship.
Exactly.
And again, I say that, you do the research. Often it's a better thing to be guided through a recommendation of a therapist than just to go in willy-nilly and look at qualifications and go, this one's right. Trust yourself, trust your intuition with the therapist. And like you said, Belinda, if you're not comfortable, say bye.
Exactly.
What other therapies?
I was thinking there's so many out there. That's the point. That's what people get. And also, psychoanalysis is not covered under private health insurance either.
No.
It's if the person is a psychologist, yes, but not psychoanalysis itself. And that's where, it is a problem. In France, it's a problem now too, about people. They're now registered, or they're now getting rebates according to their profession, not to their therapy.
Oh, right.
Yep. So if it's a psychologist who's practicing psychoanalysis, you get covered. But if you're
in France or here?
Here.
Right.
In France, they're struggling with it.
Because the European countries tend to be a lot more accepting of analysis.
They have been, and I think
even Egypt.
Even
it's all
South America.
Yeah, psychoanalysis.
Completely. It's just second nature. You get it. I was in a taxi in Buenos Aires, and he knew where all the Lacanian analysts were. So it's it depends on kind of where you are, and also it's cultural. Here in Australia, it's like
it's so conservative.
It's like get a grip on yourself.
Yeah.
Whatever. It's changing. There's a lot of people I hear now saying, my therapist said.
Thank God.
That kind of stuff it is changing. But you do have to buyer beware. There's multiple different kinds of therapy out there. And I've also been hearing lately about the ayahuasca therapy.
That's ridiculous.
And all different. So,
But that's kind of, we've imported that from America.
Completely.
I will give a caveat in regards to any form of drugs. I don't endorse anyone taking any form of drug as a form of therapy. I am of the opinion that if you want the lasting results, you need to do the work, whether it's psychology or psychoanalysis. Drugs, again, 5 minutes of whatever, what's that going to do?
Look, one of the problems with antidepressants too is that it's very difficult to come off them once you're on them because you have to withdraw very small doses at a time, and you can get really terrible side effects coming off it because we're talking about neurotransmitters are being affected by these medications.
And look, I'm not an advocate for or against medication. in my experience of analysis, I didn't take medication because I had, unbeknownst to myself at the time, I was only 21 or 22, a therapeutic goal that I didn't want to be medicated because my father had mental illness and was medicated and he wasn't any better. But having said that, now going through menopause, one of the side effects of menopause was depression, and I needed some help with it. And I'm a different person at 53 than I was at 21 or 22.
That's exactly right.
And, you know, I said, give me the lowest dose that you can. I've never taken any drugs before. Once when I was 19, I had a puff of a marijuana and started hallucinating and went, I can't do, it's not for me.
Yes, you're sensitive.
Yeah. And so I think the decision to be medicated is rests on the client and the and therapist. But yeah, like you said, it can be a catch-22, you know.
It gets me onto the thinking about self-harm too.
Yeah.
About how you experience the urgency of your symptoms. Because anybody who's feeling suicidal or self-harming, self-destructive, or even aggressive, wanting to harm somebody else, you really need some backup, some serious backup with that, because you don't want to live with it, but also you don't want some consequences that make it hard for you to live with yourself.
Absolutely. Yeah, absolutely. But I think, you know, in a sense, I feel like there was a lot of goodness that came from COVID, regardless of how people look at it.
Yeah.
And one of the things that I think it helped with was that it let everyone know that we're all of the same ilk.
Yes.
We're all humans. We all have vulnerabilities. We all have sensitivities. We all feel sad. We all feel pain. We all feel grief. And if you weren't used to spending any time by yourself during that period, there was an incidence of domestic violence and domestic abuse was rampant during that time, because people were not used to being in that space by themselves or with their partner.
And they get isolated.
Yes.
Depressed. People are still talking about how awful it felt to be in COVID. But they did increase the number of sessions people could have with the GP.
Yes. So it's kind of brought to the forefront that we all need help, and you know, mental illness is part and parcel of the human condition. And once we acknowledge that, we can then once you diagnose something, once you see that it's a problem, you can have a solution for it. You know, there's no shame in talking about it. I think.
So there's all kinds of there's counsellors. And ACAP, Australian College of Applied Psychology, they train counsellors. And they go through the whole spectrum of training in the different therapies, and they come out as counsellors. They don't have to have their own therapy, and it's not as, they have supervision. It's just not intense as the other psychotherapies. And then there's other kinds of psychotherapies, like psychotherapy. So that's the mind, therapy of the mind. So it covers, it's an umbrella term for all the therapies, I think. And then CBT is a therapy, but there's also other cognitive-based therapies. There's I can't remember.
What is that tapping thing that I've been hearing about?
Yes.
What is that?
That's for tapping. It's
I know.
It's by what's his name? Anyhow, they do it for trauma. It's
Are you wired up to something?
No.
Right.
So it's to actually go where the trauma is, to think the trauma. Their eyelashes maybe go like this.
Right.
And then to comfort yourself, you tap when you feel something. Some people find it fabulous. I mean, I can't comment on it because it sounds a little bit woo-woo to me, but
it's the same. Yeah.
But that's my advice.
Especially when you're dealing with trauma. Again, I think people try to find.
It could be comforting, though.
Yeah, it could be.
It could be really.
Yeah, it could be.
So, in a way, you know what it is? It's grounding.
Right.
That's how. But it's not. The question is: do you need to go into the trauma, gouge out that trauma, and relive it in order to work it through, or what psychoanalysis would say would be, what is it about that traumatizes you most? It could be that something else was happening at the time. Not even the trauma itself. It could have been my mum and dad were going through a divorce at the time, and I felt abandoned.
Right.
That feeling of abandonment. So you have to work out your own story around the trauma. So that means language, applying language to the issue. Whereas this isn't language. This is
it's somatic.
a somatic. Yeah. So there's somatic therapies out there. They're quite solid, but they're focused on the body.
Yeah.
And there's a lot of people practicing it now.
Yeah. I mean, I think like anything, Belinda, I think when we understand that to be a human being means to be integrated, and that is a mind, a body, a soul, and a spirit. So the trauma not only lives in your unconscious, it lives in your body.
That's correct.
And I do recall there were times in my own analysis when I couldn't remember something, but I knew in my body it had occurred. So, again, it goes back to trusting yourself and trusting that this body has it is the most superbly intelligent creation on the planet. And don't doubt yourself. If you're questioning something, it's there, it's there, right? And the body is a part of that, not just the mind, not just like the soul. Yes, everything's intricately.
The yin and yang is the mind and the body. And they talk, but you have to learn the language.
Exactly.
You have to learn your own language of not only your own body, but your own unconscious.
Yes.
And that's particular to Lacanian psychoanalysis, is the unconscious is structured like a language. So the work of analysis is, to understand that, to understand the nature of, and that's also, I mean, I'm a real fan of mindfulness.
Yeah, I agree.
And meditation.
Yeah.
Because when push comes to shove, it's about what you said before. How do I sit with myself in my life?
Yeah.
The good, the bad, the ugly of one's life. How do you sit with it? Because for some things, there's no cure. It's life. It's breathing in and out and bearing and tolerating and having some self-discipline around what that means. The other side of it, of that coin, is to actually understand or come to terms with, why are you on the planet? What are your skills and talents?
It's an existential question.
And what can you do with your life that will make it more productive or a life worth living in your own eyes? And I think that's an important question for people to ask when they're in therapy.
Well, but listen, if it's good therapy, if it's conducive to harmony and to rebuilding yourself and to making you a better human being so that you can live with yourself and others harmoniously, it will organically come up. The question has come up for me throughout my life. And the other thing, to your point about how everything's integrated, is it's not just mind, body, soul, but your intuition and your intuitive faculty. Because what I noticed through my analysis was that thing that I had, that stirring inside of me that guided me as a child as to whether I should be around certain people or avoid them, started to resurface again. And I started to cultivate it, and it became stronger and stronger. And now I just,
you begin to trust yourself. You have more confidence in yourself so that you know what you want. Not exactly, but you have a knowledge, let's say, around what you're wanting to do, and it'll annoy you until you're on your own path, but you trust the process. That's quite rare, I think.
I know. I've been told that often. I've also been told that it's quite rare that to have integrity, which I was laughing at. Who was it that said it to me? I was meeting with someone preparing an episode, and we were talking about integrity, and she said, but most people don't have it.
Oh, yes. I think what you see, we're getting into more the process, isn't it? That over time you develop an understanding about what does it mean to be a human being, and you look around you and you begin to think, there's a lot of stuff going on in the world around you.
There's incongruencies
that you could be quite depressed about. And so what is a human being? What if they don't have what we're talking about is, let's say, the more therapeutic you are, the more ethical you are.
Right.
That's the question.
Yeah.
I mean, people might argue the other side of that one. So when we're talking about ethics, I suppose primarily it's ethical towards yourself and the others around you and how you are in the world.
Yes.
But also, and that becomes a value, though.
That's one of my highest values, is that what I'm speaking and what I'm doing and how I'm thinking and how I'm behaving are all aligned. So what we'll find often is that most people will say something, but their behavior is totally incongruent to that.
So are you saying, this is me being devil's advocate, that if people haven't actually had an experience of internal exploration, i.e. through therapy or some kind, they're less likely to be in touch with their ethical side?
Yeah, I pretty much am. I am. I'm not saying that if you haven't had therapy, you're not ethical. That's not what I'm saying.
No.
I'm saying that in understanding yourself and understanding, and these existential questions come up organically, you start to go, you know what, this is me, this is how I feel. I want to leave the planet a better place for me having been here. And when I say I'm going to do something, I do it. When I decide not to do it, I'll tell you equally that I'm not capable of it, or I'd prefer to do something else. But the alignment between a mind, a body, a soul, and the voice, the words, the actions, and the thoughts means that you're in harmony as well. And you're in harmony with the universe.
You're not hiding.
You're not hiding.
And you don't need to hide or defend so much anymore. Or if you do, you can rectify it pretty quickly.
Yeah.
And that makes a big difference.
Yeah. I had, when we did the episode on domestic violence, and I had an investigative journalist, Melody Harrell, who said to me, "You seem like you've got it all together." And I said, "Oh, what does that mean?" She said, "Like you've got it all figured out." And I said, "No, I'm a human being, and I'm learning along the way."
It doesn't mean you don't suffer.
It's exactly right. And I said, "I have vulnerabilities." She said, "No." I said, "What do you mean by that?" And she said, "You love yourself." And I said, "Yes, I do. I do love myself. And I've worked very hard to get to this point on loving myself, and not in a vain way."
No, it's respect.
It's respect. And when you respect yourself, you respect others. You just do. You just do. And so it sounds like I'm definitely an advocate for psychoanalysis, but I can't help but be the example of it.